Yeah.
Thank you. Thank you. Great. So my name is Lisa Neal. I am the Associate Director of the Ombuds Office, and the Ombuds Office has been around for almost 20 years on both campuses. And as this first slide says, our office is here to help you as students with anything that's a conflict related to your program with another person, the school, a professor. And then I also put in a little button that's circulating in our ombuds community. Not only does I think this help you say the word properly, ombuds, but also just kind of reminder that this is where you go when you don't know where to go. We're a good first place to start. And I'm going to walk you through why that is um, in just a second here. So I want to just first tell you what we are, our principles of operation here. So first of all, we're voluntary. Nobody can make you come to our office. Nobody can prohibit you from coming to our office. Sometimes people will say, or a professor might say, you need to talk to the ombuds office. And if you feel like you want to go back to that professor and say, yes, I went, sometimes it can just be that conversation. Yeah, I contacted the ombuds office. We are confidential, and I do not disclose that I've talked to anybody. So that information remains in our office. We don't keep any records. Unless I have your permission, I'm not going to confirm or deny that I've met with anybody. And our only exception here is imminent harm to self or others. We're also not mandatory reporters. So I can talk to you about issues around conduct, how someone is acting, data collection, whether there's some, squirrely things happening there. So those types of mandatory things, I'm not that person. And so you can come safely to our office and share, and nothing happens as a result unless you want to take it further. And again, the only exception is imminent harm. We're also impartial, so I don't advocate for anybody. I don't, we see faculty, staff, and students. But it's not my job to advocate for anyone. This helps though, because it gives me a 30,000-foot view as to what's happening. And so I might come up with different ideas than friends and family might for you. And so that could be helpful. I also can facilitate informally between parties if it's interpersonal in nature. Let's say it's a roommate issue and you're not getting along. If all parties are willing to go through the process and I feel like it would be beneficial, that's something I can do. And that impartiality is really helpful there. Next, I'm informal. So I can't participate in anything formal, but I think one of the best ways we help with people is I could anonymously find out what a formal process looks like for you. That could look like me calling your program and just saying, how does a student appeal a grade? And I'm not going to give any identifiable information about you, but I'm gathering information for you. They don't know who I'm gathering that information for. I can also help with conversations. I need to have an important conversation with my professor. So I can walk you through what might be the best language to use so that you come across as professional, not emotional, but still get your point across. Then lastly, we're independent of any other office. We're not affiliated with, human resources or legal or risk management. We report directly to the provost's office. So there's where that gets us out of that mandatory reporting obligation. All right. So these are some issues, not limited, but some issues that you can bring to our office. Okay, interpersonal disputes, student to student, professor to student, program to student. And again, we're a sounding board. We're here to help you figure out what you want to see happen. We never tell you what to do. We ask you what your goals are and then lay out options accordingly. If you want to find out information how to appeal a grade, or there's a disciplinary action that's come your way, hopefully that is never the case, but we're a good, safe place to come to. Again, we're not sharing that information with anybody unless you give us permission. This might be around with the professor. what you want to see happen, treatment, behavior, an issue, an apology. Sometimes, and you've got a lot of training under your belt, I would guess that you have very little training around conflict. And that's pretty true in the United States, regardless of sector or profession. So our office is a good place to come to if you're like, I don't know how to approach this. I need some skills around that. And then, like I was saying earlier, if there's issues around ethical concerns, conduct, research, we can find out for you what that looks like. And then also group dynamics. We're not getting along. We used to do really well. What's happening? We're here to help you diagnose the conflict. What kind of conflict is this, and how might you address that? All right, so I do see that there's some things in the chat, but I don't know. Great. What does ombuds mean? Ombuds is a Swedish term. It means ear to the people or facilitator agent. And the first ombuds office opened up in Sweden in the 19th century. So it's not an acronym of sorts. Thank you for that. Yeah, it's cool. See, now you have something to talk about at a cocktail party, I always say. So how to get in touch with us? We have a website with a lot of resources on it, self-learning as well. Here's my email address and then my director's email address, Melissa. Feel free to either give us a call. Nobody can get that information except us. We are not on campus. We will not be on campus until the fall, and then it will be by appointments only. But we've been doing Zoom pretty effectively with people. And thank you for this comment, Molly. Yes, we're here to help and support you in your journey here at CU. I think I'm right on time too. That's impressive. I'm impressed with myself. Any other questions for me before I jump off? What if we have some kind of concern we want to bring up? And honestly, yes, we are the exact perfect office to come to, and you will remain anonymous in our office. We're here to be that sounding board for you to help you figure out what resources are available to you, what options you have.
Thank you so much, Lisa. We really appreciate your time.
Absolutely. I always say, I hope hopefully you never need us. It's conflict free here at the university for you. You have a wonderful time. If not, if there's something that just you want to talk through, that's why we're here.
And I think we had one more question, Lisa. Are personal matters okay to bring as well?
It's a good question. I don't know what personal matters means, but let me tell you some things that people have brought to us. I'm not getting along with people in my cohort. Yes, bring that. I am not getting along with my roommate. Yes, bring that. I can give you some options and some resources. I think I need some counseling. Yes, I will put you in touch with resources for that. I wouldn't be the one giving the counseling, but again, think of that button, where to go when you don't know where to go. We're a good place to start. All right, great.
Perfect. Thank you again.
Thanks. Welcome, everyone.
And I know that I think I saw Dr. Sarantino pop up in the list of participants. So Dr. Sarantino is an access coordinator with the Office of Disability Access and Inclusion. So I'm going to turn it over to her.
Thank you. Thank you, Amy. I also want to take a moment to say welcome to CU Anschutz School of Nursing. I hope you're all very excited to be launching into this new health professional career. I also want to quickly introduce myself and Emily, my colleague, who is brand new to CU Anschutz. Emily, would you like to introduce yourself first?
Hello, everyone. My name is Emily McGee. As Dr. Santino just said, I am brand new to the University of Colorado, and I am very excited to be here and very excited to help support any students that might need our office.
And again, I'm Jan Sarantino, and I have been working in the Office of Disability Access and Inclusion since last fall. And it's likely that you won't see me too much longer since we have Emily in the office, but I'll be around for a little while. But most importantly, we wanted to take a few minutes to inform you about our resources available to you on campus. We're a pretty valuable resource to students at various times in their academic career. So let us get started and tell you a little bit more about our office and how we operate and support students. So first of all, the Office of Disability Access and Inclusion, we use the letters ODAI as a little bit of a shortcut, but we want you to know that Anschutz expects that students with disabilities will be a part of every program on campus. Not only do we expect students with disabilities, but welcome students with disabilities into the health science programs. It's important to understand and reflect on the contribution that individuals with disabilities make within the diversity of the College of Nursing. It also reflects on the future patients that you are going to be working with. Secondly, it's important for you to know that ODAI is a confidential office. I know that you were just talking with the Ombuds office. They are a separate office as well that uses confidential information and keeps it separate from the campus. Our office as well keeps all information confidential. No one has access to our records or any disability documentation unless there is a serious need for someone else to be aware of something, and that is extremely rare. I career, it maybe only happened in 30 years, it's probably only happened 15 to 20 times. So, and even in those situations, we never share disability documentation. So that means that if you are registered with our office, that faculty and staff and administration will not know the reason why you are registered with the office. So that brings me a little bit to talking about disabilities. And disabilities, by and large, are invisible. Most disabilities fall into the categories of health, chronic health, or psychological disorders like anxiety. And very few are able to be seen by your peers. And so because of that, we need to meet with students early to talk about accommodations. For example, we work with a lot of students who experience anxiety, depression, ADHD, PTSD, learning disabilities, asthma, sleep disorders, IBS, and other disorders. All of these things are invisible, and because they're invisible, you won't know that a student is maybe that would be served by our office. And so it's really important that you know about our office and are able to refer your friends and peers on campus. But anyway, regardless of the disabilities or the actual diagnosis, these conditions often create barriers. And they're barriers to your academic program or barriers to the University of Colorado Anschutz campus environment. And so when we're meeting with students, when we're meeting with students with disabilities, we're wanting to really understand the barriers that they might be experiencing to certain portions of the program. For example, a student with anxiety or depression, may experience difficulties with concentration during a lecture or during an exam. So ODAI identifies these disabilities as barriers, or these difficulties as barriers to fully accessing your education. And so when students contact us early, we can develop a good accommodation or a reasonable accommodation to assist with that barrier and allow them to fully access their education and not be hindered or miss important information in the curriculum. So we meet individually with students to understand the barriers caused by the disability or by the diagnosis. And let me share another example. Someone with diabetes may rely on a phone app to monitor insulin. And this barrier could be loss of time during exams to monitor and administer meds. So a potential accommodation for that person could be adding some extra time to the test window. So as access coordinators, Emily and I determine accommodations that reduce or eliminate barriers. And this is not only available to students. People can become disabled at any time due to an illness or an injury. As a matter of fact, first thing this morning, I had a phone call from a student who just learned that they're probably going to have surgery before they even start their program in the fall. And because of that, she was worried about how in the world was she going to be able to take notes in class. So Emily or I will meet with that student, find out exactly what's going on, and then figure out what accommodation we can provide for her so that she can fully participate. So the second important piece I wanted to chat with you about was the fact that as future health professionals, it's so important that you know about our office and that, yes, accommodations can be provided to students while they're on campus, but when you meet with your patients, they may be employees at either in hospital or clinic that you're working at, or they might be employees in some other environment. And it's important for you to be able to advise them or inform them that while they're recovering, they could possibly be eligible to receive accommodations in the workplace. And generally that happens through the human resources function of that employment. And the only thing that that person needs to do is to contact their employer, their supervisor, and let them know that they're going to need some accommodations either on a temporary basis or for the foreseeable future. And generally the supervisor will have them meet with an HR person who determines accommodations. And so accommodations are not just happening here at CU Anschutz and other universities, but they also happen in the workplace. And it's just so valuable when you can share that information with the patients and clients you work with. So I mentioned a little bit about how we determine accommodations. Again, we look not so much at the diagnosis, but at the barriers or the limitations that are caused by the diagnosis. And we look for ways to implement an accommodation that will reduce or eliminate that barrier that you're experiencing. Finally, ODAI provides temporary accommodations. It's really interesting. During winter break last year, at the conclusion of break, I met with so many students who had gone skiing or snowboarding or hiking during the break and came back with broken arms, broken legs, surgeries, and concussions. And so what we did was we found accommodations or accommodations to help them through the start of the spring semester or maybe the entire spring semester, to help them so that they did not have to miss out on any of their program. I can recall one student, not at CU Anschutz, but at another university, who was on a study abroad experience and was in about the last week of that study abroad, and she was in a Vespa accident and broke her back. And they were just totally devastated because she was up for a Fulbright scholarship. And so someone referred her to our office. We were able to meet with her, and we actually provided her with a little scooter that traveled around campus so that she could go to all of her classes without having to walk. And it was just such a tremendous help for the family. So we find ways to students with permanent or diagnoses as well as temporary. And at this time, I'm going to turn it over to Emily.
Awesome. Would you mind sharing your screen for us?
Oh, I'm so sorry.
So sorry, I did want to interrupt.
Let's see what I can do here. Oh my goodness. Oh gosh. Let me do this. Oh, Jan, I can't believe I did that. Share screen. Let me get back up to that. Oh dear. Okay, so there was everything that I covered, and very quickly, I'm going to turn it over to Emily, and I apologize.
So the process of getting started with ODAI and getting registered with our office is an interactive process, and the entirety of our relationship with each other will be interactive. It is really 3 different pieces that we look at. So you'll start by going to the ODAI website. There's a short form on there where you will fill out what your diagnosis is and what some of those barriers are. So Dr. Sarantino spoke a lot about those barriers that we experience. And part of that is just thinking about how we're going to be able to level the playing field. And that's how we're going to eliminate some of those barriers through accommodations. After you fill out that form to explain some of the issues that you currently face, or some things that you feel like you may face in the future, you'll also upload disability documentation. I did see a question come through asking if documentation was required, and documentation is required. And all of the guidelines for the documentation is outlined on our website, so you can review all of that information there. Once you have filled out that form, uploaded your documentation, you're going to schedule a meeting with one member of our staff, depending on who that is, obviously, at the time. And in that meeting, what we're going to discuss is really that form that you filled out. Where do you feel like those barriers are? What accommodations have you maybe used in the past that have been very helpful for you? What accommodations do you feel like would be helpful for you moving forward? At that point, once you've been approved for the use of accommodations, a faculty memo notice is sent out that lists out those accommodations that you've been approved for, and then you're able to start using them right away. One thing to understand as well is that if for some reason those accommodations aren't working for you, or something changes, again, maybe it's that winter break and something happens and there's an accident, or maybe there's just a change in your current level of functioning with your diagnosis, we can always go back through those steps to determine what might be a more beneficial accommodation moving forward. So don't feel ever as though it's a one-time only deal. This process can be repeated multiple times. And that is to ensure that you are receiving the most appropriate and reasonable accommodations. Would you move on to the next slide, please? So how to contact us. So you can go to our website. That is obviously, like I said, the first step. You can also send an email to disabilityaccess@cuanschutz.edu. You could give us a call, anything really to reach out and to get a hold of us. If you are just on the CU Anschutz website, you can search just for disability access or disability resources, and our website will pull up as well. I think that's all that I had. Does anybody have any questions for us at this time? What types of accommodations does the school have with dyslexia or other reading disabilities for online testing? That's a great question. And there's no one answer because every single person is an individual and the barriers that you experience are individual. Some examples could be the use of an ebook or having some reading software. But again, it would really depend on that individual conversation that we have to determine what is going to be the most appropriate accommodation in that situation.
So I'll add a little bit to that question. We have a lot of students on campus who experience some form of dyslexia, and there are a number of different ways that we can address it, as Emily mentioned, either through some type of technology or other additional resources, using our testing center so that you can listen to the questions aloud. In the past, sometimes we have embedded audio clips in with each question in an online exam so that you can listen to that particular question aloud. So we've done a lot of creative solutions to help students with dyslexia.
So thank you so much, Emily and Dr. Sarantino. We really appreciate your participation and the information you provided.
Thank you.
Okay, well, we're here if you need us. And again, welcome to Anschutz and congratulations on being accepted into the program.
And I don't know if one of you could maybe share the presentation by email and I can add it to the online Canvas orientation shell for the students as well.
I will send it to you, Amy.
That sounds great. Thank you so much.
Okay.
Thank you.
Bye-bye.
So our next presenter is Rebecca Brannon, and Rebecca is the Student Health Insurance Manager. So I'm going to turn it over to her. And what we'll do is feel free to enter questions in the chat, but Rebecca's going to go through her presentation first, and then we'll get all the questions at the end. So Rebecca, take it away. Thanks for being here.
Of course. So as Amy said, I'm the Student Health Insurance Program Manager. So I am basically your main contact for all health insurance and dental insurance related issues. That includes the waiver, enrollment, and then just questions regarding claims or benefits in general. So I basically act as a liaison between you and the insurance company. So if you ever have any issues throughout the semester with anything really, I'm your main point of contact, and then I'll get you to wherever you need to go, or I'll help you with whatever's going on. So anything you need, just ask me, and I'll do my best to help or figure out what we need to do to help. I'm gonna go ahead and share my screen and get the presentation going. All right. So for today, we will talk about the student health insurance policy, and then what we offer for student health insurance, as well as the dates, deadlines, and costs for the student insurance. I'll go over a basic overview of the health insurance benefits and the dental benefits that are available. And then I'll go over activating and waiving the insurance, and then contacts and resources will be listed at the end for you. Excuse me. So as I'm sure you're aware of by now, CU Andrews does have a mandatory health insurance requirement. So we do require all students who are enrolled in one or more credit hours or in an approved certificate program to be enrolled in health insurance. And that has to meet the minimum essential coverage guidelines as defined by the Affordable Care Act. So typically, if you have employer-sponsored coverage through a spouse or a parent or through your own employer, or if you have Marketplace or Medicaid, your coverage will meet those waiver guidelines. But if you have any questions about whether your coverage does meet the requirements, just shoot me an email or shoot the office an email and we'll be able to let you know. As long as you're able to provide more information about the plan, we can let you know. And then all the requirements are also listed on our website. And then I have them listed in this presentation as well. So you have that for your records. Students, if you are enrolled in a different plan, you are able to waive the student insurance. So you do not have to accept the student insurance unless you just don't have any other options. Or if you like just see the benefits and you want to enroll. But if you wish to waive the coverage, you do have to do that every single semester. The only time that you'll ever have to submit a summer waiver is this first semester. And that's just because you're newly enrolled for summer. So for future semesters, you'll only have to worry about fall and spring. So you'll be submitting a waiver for summer, this current waiver period, and then in the future, you'll submit another one for fall of 2021, spring of 2022 ongoing. And as long as you're enrolled and you have other coverage that you wish to waive with. And that, again, we send emails weekly after you've registered for classes. We send emails to let you know the waiver portal's open, here's how to waive, here's how to enroll, etc. So just keep your emails. I mean, I know you guys get so many, but try to keep on top of those student insurance emails because the student insurance fee is rather hefty. So it can be a burden if you have other insurance already. So I just like to let you know that is every semester from here going out, and you won't have to submit another summer waiver only for this semester since you're newly enrolled. And then for dental insurance, we do have a voluntary option for dental insurance. So students who wish to take our dental insurance, we each fall and spring semester, we do have an enrollment form that you will complete, and then we'll get you enrolled into the dental coverage. And then, of course, I'll give you more information on that here in just a moment. And then there are certain PhD students in the graduate school that are automatically enrolled for the dental insurance as a stipend benefit of the program. And those programs are listed on our website as well. They, like, if you don't want the dental insurance, if you already have dental insurance through your through someone else, then you can certainly waive that automatic enrollment. But it is free for you. It's a stipend benefit. So if you're eligible for that, then it's free. If you are just interested in enrolling in dental and not health insurance, if you have other health insurance and you just want dental, you can do that. It's completely up to you. You're not going to be automatically enrolled unless you're in one of those stipend benefit programs. All right, for summer of 2021, the health insurance is effective from June 1st through July 31st. So you have 2 months of coverage. The premium is $867, and that covers those 2 months. The waiver portal is currently open, so you can go into the waiver portal after you've registered for classes and submit your waiver if you have other health insurance that you wish to waive with. One caveat there is it takes 1 to 2 days before right after you've registered for classes for the waiver portal to recognize your information. And that's because the CU system runs a report every night around midnight. And then I receive that report and it tells me that you've enrolled in courses and you need to be added to the portal. So as soon as you register for classes, that insurance fee is automatically assessed to your account, but I don't receive that information that you've enrolled until the next day. So typically it will take 1 to 2 business days after you've registered for classes in order for your information to be in the waiver portal. So just be mindful of that. Like if you go in today to register for courses, you might not be in the waiver portal until tomorrow. Well, likely since it's Friday, probably Monday. So just give us a little bit of grace there. And then if you do have a delay of getting being available in the waiver portal for longer than 1 to 2 business days, shoot our office an email and we can get you manually added to the portal so you can go ahead and submit your waiver, so you don't have to worry about any timing issues or anything. And then if there, for any reason, you're not able to register for classes until after June 11th, we also have additional waiver options and appeal process for you. So if for any reason you're not able to get enrolled before that deadline, don't fret. We will be able to get it figured out and help you get with getting a waiver submitted after the fact. But of course, if you're able to get it before June 11th, that's going to be easier for you and easier for everyone. Then for dental insurance, we don't have any summer enrollment available for that. It is only available for fall and spring semesters. So I just wanted to give you a heads up that it is available this upcoming fall, and that will be for an August 1st start date. So it's coming up. We don't have it available for summer enrollment. So there is that information. And then here's a brief overview of the health insurance benefits. We do have a student insurance plan offered or administered by United Healthcare Student Resources. It is the UHC Choice Plus network, which is a nationwide network. So you'll have coverage in any state that you go to. So if you're traveling or doing a rotation in a different state, or just going home, or you work remotely, whatever the situation is, you'll have coverage in every state. The deductible for the student insurance plan is $500. And then once that $500 deductible has been met, it's a 20% coinsurance. So that means that after you've paid $500 towards your medical expenses, United Healthcare will pick up 80% of the cost and you would be responsible for only 20%. And that is up to a $6,000 out-of-pocket maximum. So for the most that you would ever spend, if you had a really hard year with medical issues, the most you would ever have to worry about paying is $6,000 for the full year. And then once you've met $6,000, would be covered at 100% for the rest of the policy year. Preventive care is covered at a $0 copay. That includes physicals, well women's visits, STD screenings, diabetes screenings, all kinds of preventive services. We do have that preventive care list available for you if you like. Of course, just reach out to me and I can provide that for you. I am working on getting that added to our student insurance website so that you can access that without having to take any action to get it. Additionally, physician visits are $25 copay. This means that if you go to the primary care physician or any specialist, including a psychiatrist or an orthopedist, anything that's going on, an office visit is only going to be a $25 copay. So you don't have to meet your deductible in order for that copay to kick in. So immediately out of the gate, you have a $25 copay when you have an office visit. And then for urgent care, it's a $50 copay. Same thing, no deductible applies there. So if you have to go to urgent care, it would just be $50 when you enter. And then for emergency department visits, it is a little bit more. It's a $100 copay, and the deductible does apply to those visits. So the emergency department is going to be, of course, your most expensive option there. And of course, you can't help if you have an emergency, but it's always best to go to urgent care or use your telehealth option if it's not a true emergency. If you have a true emergency, go to the ER and get help. Prescription coverage is offered within the plan. Tier 1 prescriptions, which will be the majority of your generics and like normal medications. So your more basic medications will be a $15 copay. And of course, the deductible doesn't apply there at all. And then tiers 2 and 3, which will be your preferred and non-generic medications, those will be a 20% coinsurance, and that is straight out the gate without the deductible being met as well. So as soon as you're enrolled in the plan, United Healthcare starts paying at 80%, and you would just pay 20% of whatever that allowed amount is for those medications. Additionally, like I said, UHC Choice Plus is a nationwide coverage plan. So you will have statewide, like any state that you're in, you'll have coverage. You can just go to on our website or United Healthcare's website. They have a find a provider tool, and you would just select your zip code or the city and state that you are in at the time, select a range, like 25 miles, and they'll be able to find your provider that's in network nearby. Additionally, there's no copay at all for the telehealth option that's on the back of your car, your insurance ID card. It is Healthiest You. They offer medical and mental telehealth. So those are free and they're super helpful. So I highly recommend using, especially the counseling. It's really rare to find free mental health. So if you're enrolled in the plan, take advantage of that Healthiest You counseling telehealth. It's 24/7 available all the time. You can do Zoom meetings face to face, or you can do like just chatting if that's your preference. And then we also have a really great agreement with the on-campus behavioral health center. So the Anschutz Health and Wellness Center, they have a behavioral health department that we have a $0 copay agreement with. So if you're enrolled in the CU Anschutz student health insurance plan and you want to go on campus for behavioral health to see a provider in person, those visits are free. So again, mental health it's huge, and we're seeing a huge rise in the utilization for that. And that's because we're going through a lot. I mean, and you guys are going through a lot of changes as you start your program and as you go through. So even if you're not experiencing a large amount of stress or anxiety at the beginning of your program, it is great to get a provider established and get that care started before you even need it, so you feel comfortable when the time comes. I highly recommend taking advantage of those options. And then we also have a vision benefit included in the plan. It is the deductible doesn't apply to this benefit. So immediately you have access to use this. It's a $300 maximum per policy year, and the benefit includes one eye exam with hardware, contacts, or glasses per policy year. So it is a little bit, it's not tricky necessarily, but a lot of providers are not familiar with having a health insurance plan that has a vision benefit stacked into it. So we have a lot of providers that they don't bill insurance for this. And so basically with this benefit, you would pay upfront for your services. You would pay for the eye exam, and you would pay for your contact lenses or glasses, whatever your preference is there. And then you would submit a claim for reimbursement. When you submit that reimbursement claim, they just need a copy of your receipt that shows what you paid and who you paid it to, and then a copy of the your eye exam information from the doctor that has your diagnosis code and stuff on there. And I have you can email that to them, or you can snail mail it to them if that's your preference, and you can also fax it. Of course, email is what I prefer, just so you can keep track of when you sent it, what you sent, and if you do read receipt, you can know that they received it. So I have all the information for that. If it comes up this year and you would like to use that benefit, I can send you the documentation that they need and the email address to send it to. We also have that posted on our student insurance website, so you can find it there if you need it. We also have a massage therapy and acupuncture benefit included in the plan. The deductible does not apply to that either. And you can go to any massage therapist that you prefer. There is no network necessarily for massage therapy or acupuncture. So you can go to the Anschutz Health and Wellness Center to receive massage therapy, and they will pay, United Healthcare will pay 80% of that massage visit, and then you would just pay 20%, or you can go to like any massage therapist that you may have already established care with, or whatever you prefer. They cover up to $500 per policy year, and it's the same situation where you pay up front for those services and then submit a claim for reimbursement. Those reimbursements typically are provided within 30 days of the submission of all the information that they need for the claim. So it is pretty quick, and it is pretty painless. So I recommend using those too, because, who can't use a massage every other week, And then the plan also includes global emergency services with emergency evacuation and medical repatriation of remains for 100+ miles from the home address. So if you're ever, abroad and you have any issues and you need emergency evacuation, they will we do have those emergency services available for you within the student insurance plan. I'm going to go just briefly over the dental insurance. Like I said, there is no enrollment available for summer, but in the fall, you will have the option to enroll. Anthem Blue Cross and Blue Shield is who administers our dental plan. It is the Dental Complete Network, which is also a nationwide network, so you'll be able to find providers if you're out of state. We have a $0 deductible for this plan. So immediately Anthem starts paying at 80% and you have a 20% coinsurance for your services. The deductible, again, is $0. Preventive services are a $0 copay, which just means your cleanings will be free, periodic oral exam, and your bite wing x-rays will be free. And then your fillings, simple extractions, surgical extractions, root canals, periodontic cleanings, those like a little bit more detailed services, those are going to be a 20% coinsurance. Additionally, there's no waiver waiting period. So once you've enrolled in the dental insurance, you don't have to wait 6 months to use your benefits or wait a year, which a lot of dental plans do have. So immediately you'll start receiving those benefits, and then if you need any of the basic services, those are covered at 80/20. All right, and here is the meat of the presentation. Activating your insurance is very important, and it's a little bit not tricky, but it's just something that a lot of students aren't aware of. So we do have an automatic enrollment in the student health insurance plan. So if you do not take any action to waive the student insurance, you'll be automatically enrolled into the plan. But that automatic enrollment process doesn't occur until after the waiver has closed. So for summer, if you don't take any action to waive, you'll be automatically enrolled into the student insurance plan, but that automatic enrollment process won't occur until after June 11th. So the coverage will go back, it'll retroactively backdate to the 6/1 start date, but the coverage won't reflect active in your account until until the process is closed, the waiver portal is closed. So if you were, in that meantime, if you were to go to the provider, say on June 7th, you had to go to the doctor, they wouldn't be able to verify your insurance because it's not showing active until after that waiver portal is closed. So if you know that you're intending to accept the coverage, we recommend going into the waiver portal and actually going in and activating your coverage. It's really quick. It takes about 1 minute. So instead of selecting waive coverage on the main portal page, you would just select opt-in. And then on the opt-in, it'll take you through to verify your demographic information and make sure that you understand that you're enrolling, and then you would just sign off on that. It does ask you to confirm that you understand the premium payment. That is just automatically placed onto your student account. So you're not asked to pay or supply credit card information or anything at the time of activating. It just like the system just wants to let you know that $867 is what you're responsible for the student insurance for that semester. And then for waiving, during the waiver period, if you have other comparable coverage, which, like I said, we have the waiver requirements listed online and in this presentation. So if you need that, it's available. But most employer-sponsored plans, Medicaid and Marketplace insurance will meet those requirements. So if you have other insurance, you can submit a waiver. You would just visit the website, thestudentcenter.uhcsr.com/Anschutz, and submit your insurance information. Same thing that I said earlier, your information won't be available in the portal for about 1 to 2 business days after you've registered for classes. So just keep that in mind. You'll see the fee on your student account pretty much immediately, but your waiver portal information won't be available until the next day or possibly the following day. So just give us a little bit of grace. And then if you do experience a delay longer than the 1 to 2 days, give us an email. And our email is located down here at the bottom. It's on our student insurance website, and it's at the end of this presentation. And then if an approved waiver is not submitted before the end of the waiver period, you will be responsible for the premium and you will be automatically enrolled into the plan. Like I said, if you're not able to register for classes before the end of the waiver period, let us know and we can work with you to get that a different waiver option available or an appeal process started for you to get that coverage removed. But of course, if you're able to register before the 11th, it will be smoother for you to just submit it via the waiver portal and have the system electronically verify that for you and get everything processed. Once you submit your waiver, it takes about 5 to 10 business days for that fee to be, once it's been approved, it takes about 5 to 10 business days for that waiver to be applied to your student account. Typically, it's not the full 5 to 10 business days, but we just like to, sometimes due to timing on when we pull the report from the waiver portal, you might be missed on that first week, but then it'll catch up on the following. So give us about a week, a full 5 to 10 business days in order for that fee to be removed. And then if you experience a delay longer than that, let us know and we can get that removed immediately. Additionally, if you have already paid the full tuition and then you submit your waiver, it's approved, you would be refunded that full student insurance fee amount. So it would be refunded if you have EFT set up, it'll be refunded back to your bank account. Or if you don't have that set up, it would be sent to the address, the mailing address that the school have on file. So just make sure that information is up to date so that you can receive your refund in a more timely manner. The waiver criteria is listed here. I won't go over every single bullet, but you do have to have an in-network non-emergency care providers in the Denver metro area if you're studying in person on campus. If you're studying remotely, then we just have to have proof that you have non-emergency care providers within your local area. So we check your zip code and make sure that you have non-emergency care providers within 25 miles. And then your plan just has to meet the minimum essential coverage guidelines as defined by the ACA. Again, we have those listed on our website and then we have them all here. And then it is listed on the waiver whenever you go to submit that. Our contact information is listed here. Our email is studentinsurance@cuanschutz.edu. And then we also have our Anthem, Blue Cross and Blue Shield, and United Healthcare information listed there. And then we work super closely with the bursar's office, of course, with getting those waivers approved and applied to your accounts. So if you're ever having any issues, we work really closely with them. So you can email them or us with regard to your billing inquiries and we'll help you get it straightened out. We also have additional resources listed here. So if you're not super familiar, which a lot of people aren't super familiar with, deductibles, out-of-pocket maximums, copays, and what applies where, which provider to go see for what kind of condition, things like that. That is all available in the Help Center. We also have quite a few like 1 to 3 minute videos posted on our student insurance website that goes over just a quick overview of deductibles, out-of-pocket maximums, and copays, because those are typically the trickiest. We also have information on reading an EOB. So once you go to the doctor, you will receive an explanation of benefits, which shows what was charged, what United Healthcare paid, and what you're responsible for. And it just goes over understanding what that EOB is telling you. So I recommend if you're not super familiar with insurance terms, or if this is your first time ever having your own health insurance, they're really helpful videos and they are very short. So they're clear, concise, and they'll help you a lot with understanding what you're dealing with when it comes to health insurance. And then if you have extra questions, of course, like you don't understand any part of the videos, or you just don't feel like watching the video and you just want to ask, that's what I'm here for. So reach out to me and I can help you understand pretty much anything that's going on. And if I can't understand it either, then I'll help you find the answer. We also just have other options for student insurance available here. We have Colorado Medicaid listed and Colorado Healthcare Exchange. Those plans that are offered there are also, they definitely do meet the waiver requirements. So if you were to enroll in a different plan, you can use those plans as a waiver in order to submit a waiver for the student insurance. And that is the end of that. So I'm just going to go back to the beginning here and then I'll have Amy go ahead and ask me whatever questions are available.
Yes, thank you so much, Rebecca. There certainly have been a number of questions.
Yeah,
Let me try to pop up to the top. Give me one moment.
okay.
Okay, so I think that you already covered this, but will there be emails or announcements to remind us when to waive the insurance each semester?
Yes, so we send out emails closer to the beginning of each semester. So the fall emails haven't started yet. And our summer emails are going out, but they go out weekly after you've registered for classes. So if you haven't registered for classes yet, you likely haven't received an email yet. But we do have the waiver portal information listed at the very top of our homepage of the student insurance website. So if you haven't received emails yet, but you have registered for classes and it's been 1 to 2 days, you'll be in the waiver portal, so you can go ahead and submit that information. But each fall and spring semester, you will receive emails after registering for classes as well.
Okay, and can students accept the dental coverage without the health insurance?
Yes, you don't have to enroll in both. You can do one or the other or both if you want.
Okay, and then I think you covered this. How long does it take for the insurance fee to be deducted? I think you said 5 to 10 business days on that, right? After the waiver's been approved?
That's correct.
Okay. Does the student health insurance cover providers within the UC Health system?
Yeah, so you can go to any UC Health provider that you would prefer. There's also other hospitals available. So if you're not super interested in staying within the UC Health network, there are other provider groups that are in network as well. And we do have the Find a Provider tool listed on the website. So if you want to go on there, it will just ask you to put in your zip code, and you can search for by hospital, you can search by medical group or specialty, and it'll help you find a provider. If you already have a provider established, you can just go on there and verify that your provider's in network. But all CU Medicine and UC Health facilities and doctors will be in network, including the on-campus health center.
Great. And students get an insurance card, correct?
A physical ID does not get mailed automatically. It's in your UHCSR My account, that online account that you can create. Once you create that account, you can go in and actually request a physical ID card be mailed to you, but they don't automatically send you one physical copy. And if you're not interested in setting up an online account, I can access that for you and request a physical ID card be mailed to you. But it's up to you if you don't. Some people are not interested in having an online account associated with their health insurance. So let me know and I can get that for you if you like. But you can request a physical one if you like.
Okay. So if students already have health insurance and they opt to keep the student health insurance with CU, would the student insurance be secondary or would it be billed first if used on campus?
That's a good question. Typically, it's determined by the insurance companies themselves. They coordinate benefits based on typically whatever insurance you were enrolled in first will be primary, and then if you add the student insurance, that would be secondary. But the insurance companies themselves work that out on who's primary and who's secondary. But I believe that's typically how it works, is like if you're enrolled in this one for 10 years, it's going to be primary, and then the one that you add on would be secondary.
Okay. After graduating from the program, how long are students able to remain on the student health insurance through COBRA?
Yeah, so it's basically COBRA, it's called continuation coverage, and it's available for 3 months after you've graduated. So if you say you graduate in a spring semester, you graduate in May, your coverage will be effective for that full spring term, which is January 1st through July 31st. And then you'll have an additional 3 months after that to enroll in the coverage if you like. And then same if you graduate in like December, your coverage, you would be available to enroll for January, February, and March of the following year.
Okay. And do students need to get a referral prior to going to mental health, massage, therapy, or acupuncture?
Nope, no referrals are required on this plan. So if you already have care established with a specialist, like a mental health provider that you like, or any other type of specialist, you don't have to have a referral. Of course, it's the same copay either way. So it's not going to necessarily save you a whole lot of like money or time to go to a PCP if you already know that you need to see a specialist. So it's really your preference on that. You don't have to get a referral.
Okay. And another student asked, can you use the massage therapy benefit if you don't accept the student health insurance?
Unfortunately, no, it is a benefit included in the student insurance plan only.
Okay. How much does the dental cost?
The dental this year, that is, let me double check. It breaks down to about $23 per month or something. Let me double check. Yeah, so it's billed by semester, but the for this year it was $112 for fall and then $157 for the spring summer. So that's about $22 to $23 per month.
Okay, and while you're looking at those fees, another student asked, we understand that the coverage is $867 for the summer. Is that consistent every semester, or will the fall and spring be different, and does it change year to year?
It does change year to year based on insurance rates. So we go for renewal each year on the plan, and we are currently in the renewal process for the upcoming plan year. So at the end of July this year, 7/31 is the end of our current policy year. And so at the end of each policy year, we go through a renewal process, and it really is dependent on the utilization and claims rates and everything with the Colorado Department of Insurance has to approve. And so we don't have the upcoming plan year's rates yet, but it does change year to year. And the fee is different for fall and spring because fall has 5 months of coverage and spring summer has 7 months. So it will be a little bit more for the spring semester versus the fall each year. And then the rates do change every year. So they can go up, they can go down. Typically insurance rates do trend up. So we can't ever say for sure that it's going to be an increase. But every single year that I've ever had my own health insurance for the past 15 years, it's gone up. So yeah, it does change every year. And we post those rates as soon as we have them available. We're in the process of renewing and trying to get that approval from the Colorado Department of Insurance, but we don't have that information yet. So as soon as we have it, we'll post it on our student insurance website, of course. And then we haven't set the waiver deadline yet for fall, but it is typically available at the end of July through early September. So just be mindful that you'll start receiving emails regarding the waiver closer to that time. And then we'll have everything posted online as soon as we have it.
Okay. Is there a way, Rebecca, that you can add the activation link for the insurance in the chat?
Sure. And it is the same as the waiver portal link. I'll definitely put it in the chat for you guys, but it's all the same portal. You would just, instead of selecting waive coverage, you'll select opt-in.
Okay. And then related to that, another student asked, do you have to activate the insurance every semester since students have to waive it every semester?
Yes. So if you don't want to have that technical, it's not an actual lapse in coverage. It's just that your coverage looks like it's not active until the portal closes. So if you just don't want to have any issues if you go to the doctor in the middle of the waiver period time, yes, you'll want to go in and activate each semester. I am sorry, I know that's a pain, and we're working on getting the waiver process and activation to be a little bit smoother, but at this time, that is how it works every semester.
Okay. In addition to putting in that link, can you also put your email, the office email in the chat as well, Rebecca?
Yeah, of course.
Okay. And then one student asked, sorry, I'm asking you several things to do at the moment.
Oh, it's okay. You're
Once
good.
you finish putting that stuff in the chat there, can you go back to share your screen? There was a slide, I think a student wanted to take a screenshot of it. I think it had the different phone numbers and like links as well.
Yeah, of
I
course.
think it was maybe the second to last slide. I can't recall.
Yes, it is important contacts here.
I think that was it.
Okay.
And then, sorry, let me just see if there's anything. I got to scroll up again.
Okay.
Just give me one moment.
And then
Okay.
just really quick, if anyone has any questions that they didn't feel comfortable asking in the chat, or if you know, I know that you guys are getting a lot of information right now. So if you have any follow-up questions after the meeting or after your orientation today, you can always email our office and we'll get back to you.
Great. And I think so one of the questions was about the insurance card. I think you already covered that. I think I've already put Rebecca's slides on the online orientation shell in Canvas, which is just that traditional summer 2021 traditional Canvas shell that you have. I'll double check, but I'm pretty sure it's already out there in the modules area. Okay. And what were the conditions for being eligible for the dental? Is it any student that's eligible, or?
Yeah, any student who is eligible for the student health insurance. So it's the same if you're enrolled in at least 1 or more credit hours in a degree seeking program or an approved certificate program, you'll be eligible to enroll in the dental insurance. The only thing I had noted here is that some students in the grad school are eligible for that automatic enrollment. And those students that in these certain programs are listed on our student insurance website as well. And if you have any questions about that, your program administrator should be able to let you know, and you should probably already know ahead of time.
Okay. And so if a student signed up for the CU health insurance, is the out-of-pocket max and deductible for the calendar year or just the school term? And
That is a good question.
So hang on, it keeps going as well.
Okay.
Sorry. These are
Sorry.
good questions, Tracy. So if we only sign up for the fall term for health insurance, do we have a prorated deductible or out-of-pocket max? Can we sign up for health insurance mid-semester is the last question there.
Okay. So the only way you can sign up for the health insurance mid-semester is if you lost your other coverage. So if you submitted a waiver and then you turn 26 mid-semester and you lose your parents' coverage, you can submit a qualifying life event form, and that will allow you a special enrollment. You have to submit that form within 30 days, either before or after losing your coverage. And you will need proof of that loss of coverage. So your current insurance company would send you a document that states that you're losing coverage as of this date. And you would just need to submit that along with your information on the form. And yeah, we can get you enrolled in the student insurance plan mid-semester only in those circumstances when you lose other coverage. So, and it doesn't have to be that you turn 26. It could be that you're going through a divorce, or you know, like whatever happens that you lost coverage. It's just the loss of coverage that triggers that special enrollment period. And then with regard to the out-of-pocket maximum and the prorated deductible, that information. So no, there is no prorated deductible or anything like that. But if you were enrolled for fall only, you're only enrolled, like the actual benefits don't change at all. But the benefits are based on the policy year, not the calendar year. So the policy year starts on August 1st and it ends on July 31st every year. So if you are enrolled for fall coverage and then you re-enroll for spring, your deductible doesn't reset, and everything that's already been met towards your out-of-pocket maximum will stay and carry over to that spring semester. But if you're only enrolled for fall, you still have the $500 deductible. And then if you were to enroll in continuation coverage, like you graduated that fall and then you went ahead and enrolled for those 3 extra months of coverage, everything would carry over through those 3 months as well. But there is no like prorated deductible or anything for those students who are enrolled for fall only.
Okay. So we're running out of time here. We'll get to these last couple questions. So for Healthiest You, what is the
Uh-huh.
school ID for registration purposes?
It's just your ID number, your student ID number.
Okay,
So your 9-digit student ID number.
okay,
And that will be on your, you'll have an SRID, which is your member ID for health insurance. I'm sorry, student resources, the United Healthcare SR. But then your student ID will be what you register with.
will there be a gap in coverage before the fall semester?
No, there won't be. The only reason you would ever have like a technical gap is if you don't go in and activate your coverage. But if you wait until the waiver portal closes and you just accept the automatic enrollment, the coverage will be retroactively backdated to the 8/1 start date. So your summer coverage ends on 7/31 and then your fall coverage starts on 8/1. So there's no actual gap in coverage. The only time you'll ever have, like, it might look like it's inactive if you haven't gone in and activated that fall coverage.
Okay. So we just got, I think, 2 more questions here. So a student asked if she has insurance through work, but wants to take on the CU insurance. Does that make her eligible to discontinue her current work health insurance, or is that not a qualifying life event? She basically doesn't want to pay 2 insurances, but she likes the idea of being a network with UC Health with the CU health
Okay.
insurance.
That would be a question for your HR. I'm not sure. Some plans allow you to end, like whenever you want, to terminate your policy. Some require you to stay enrolled for the full policy year, for whichever their policy year is for. So I would ask your HR if that's an option to terminate your coverage early. And then additionally for student insurance, once you're enrolled for that semester, there's no option for early termination. So just keep that in mind. If you enroll for fall and then you're offered new coverage mid-fall, we won't be able to terminate your coverage until 12/31.
Okay, and I think when you had posted that stuff in the chat, that was still a direct message to me. Do you mind
Oh, whoops,
reposting
sorry.
it?
Sorry.
That's all right. And then I
Yeah.
think the last question was, when is the fall waiver period? And I think you had said that that's not been scheduled yet, but it's typically, did you say like late July into late
Yeah,
August?
usually we open it like a couple of days before the policy starts. So it should be available around July 29th, and then we keep it open through early September. But as soon as we're working on getting those dates set. We try to keep it aligned with the bill due dates so that you can get your waiver submitted before the bills due. So I'm working on getting that set now. And as soon as I have it, I'll post it on the student insurance website for you guys.
Fantastic. Thank you, Rebecca. So students, since that session ran a little bit long, kind of right through our break, let's at least maybe take 2 or 3 minutes here, and then we'll get our student orgs ready to go. And Rebecca, thanks again for your time.
Thanks. Let me know if you guys have any more questions.
Sounds good.
Bye.
A lot of us haven't had the opportunity to do so. So that was pretty fun to learn. We're able to get patients medication access. And so we're able to pretty easily offer patients over-the-counter medications for something that's within their financial means. And we're also able to get patients signed up for prescription programs and just ways to get people medications where they wouldn't be able to otherwise. And I talked about a little bit, we're able to help patients out with transportation to and from the clinic if that's something that they need. Olivia spoke about the specialty nights on Wednesdays. Beyond that, we have dental that is available, physical therapy, mental health resources, all sorts of stuff. We're able to meet the patients where they're at. Okay, so like we said, we're going to be contacting you guys again as you reach the point where you're about to be eligible to volunteer with Dawn as a full nursing volunteer. But if you have any questions in the meantime, feel free to reach out to any of us. If you contact that email in red, the email will go to all of us and we can answer your question appropriately. Or if you, like I said, if you are interested in getting involved in some of those ways, in the meantime, before you pass those requirements, let us know as well. We'll be happy to help you out. And that's all I had. I don't know if we have time for questions, but if there was any questions, we're happy to answer them.
And Erica, would you mind emailing me a copy of your presentation? I'd like to add it out on the orientation shell. And my apologies, I didn't start the recording right away, so I just want to make sure that the students get the information.
Absolutely. Yeah, I'll send that to you.
Perfect. Thank you so much.
And if we're running low on time, then the Dawn leaders can try to answer all of these chat questions in the chat while we move ahead with the orientation.
Yeah, if you all don't mind doing that, that would be amazing.
Okay, yeah, we'll just address your first name and then try to answer your question the best that we can.
Okay, that sounds great. So I guess, Jesse, do you want to take it from here in terms of CUSNA?
Yeah, I would be glad to do that. Hi, everybody. My name's Jessie. I am out of state right now, so I don't know how long my internet's good for, but we'll go with what we've got. I know this is a really busy day today, so and it's a lot of information. So I'm going to share my screen. And see if I can get this to come up. Can you guys see that?
We can see it.
Okay. All right. So I'm president of the CU Student Nurses Association. And like I said, we know today is a lot of information. So we will be visiting you in classes later on to see if you would like to participate. We did have a relaxation video. I'm going to skip that because we are short on time. But what I will say is take some deep breaths. And like they tell my 4-year-old, smell the flower and blow out the candle, because it's a lot of information coming at you at once. So what is CUSNA? It's a part of the National Student Nurses Association and the Colorado Student Nurses Association. Our mission is to bring together and mentor nursing students as they prepare for their professional careers. So we also convey the standards and ethics of the nursing profession, so where we want to hold ourselves accountable to. And we promote and develop professional skills. So there's a lot of things that we offer. We do talks. And if you have your Facebook up, I think for your cohort, you might have seen some of these that we're doing. We'll do emergency nurses, and we'll have ICU nurses and different areas of nursing to come and talk. One thing we just did Nurses Week, which was amazing and went really well. We had Nurse Mo from Straight A Nursing. If you guys have heard of her, she's great. And she came and did a talk on imposter syndrome, which we all feel like. I still feel like I'm going to get a call saying, hey, you're really not supposed to be in nursing school, just a joke. So, which we all kind of feel. So it's great to have those opportunities. We advocate for high quality, evidence-based, affordable and accessible healthcare. So we try to do as much with the community as we can. We advocate for and contribute to advances in nursing education, which are some of the things I just talked about. We also try to, if there's the continued education courses, we can't get CE credits for them yet, but we try to give the opportunity, if the school allows us to be participating in that, to be involved in some of those educational classes. And then we develop sound nursing students who are prepared to lead the profession in the future. And that's kind of the basis of what CUSNA is. Some of the benefits is that you have access to national and statewide networks of nursing students and professionals. There's pathway lectures that are offered through CUSNA and the Student Nurses Association. Professional development skills workshops, they help you to do nursing portfolios, your resume, the CEC, the continued education skills practice. We obviously, like I said, do the guest panels and guest speakers and panels, and input on how to support nursing students at CU and to foster our growth and get us ready for our careers as we move out into the field, because that's a scary transition as well. And then right now through COVID, we haven't really had the opportunity to shadow, but we do like to set up things for shadowing and to help set up contacts for that. So you may not get all the experiences that you're wanting in nursing school just because of circumstances. So if we're able to get you one that you're really interested in, help you out with that. We do offer support system with fellow nursing students and the faculty, so it is a really great support system to feel locked into and to feel supported with. Mentorship from senior nursing students, so we're all kind of there for you if you need anything, and that's kind of universal through CON, but definitely for CUSNA, we try to really support each other. And then opportunities to volunteer and to represent CON in our community. And then we have members only scholarships through Student Nurses Association, the national one. So let's go back real quick. One of the volunteer opportunities is with Dawn Clinic. So a lot of us work with Dawn Clinic. So how do you join? All you have to do is go to the National Student Nurses Association website. It is a $35 annual fee. I think they might have just bumped it up to 40 because I went to renew and I think I saw it was 40. So we are a chapter of NSNA. And when you apply and get your confirmation, we just need a screenshot of that sent to our membership committee chairs, which are Marissa Watkins and Elizabeth Phelps, Liz Phelps. And then we'll get you locked in and you'll be on the email list. And so you'll know when we do have a meeting every month for general membership to come to. And we do request that you come to that membership meeting. It's only about an hour once a month. And that's it. And I can make sure that this information's put out as well, so you all have that. And yeah, here's the meeting. So this is about the monthly meetings. Attendance, is required. So if there's a class lecture conflict, you're in clinics, clinicals, there's an illness, you just email us and let us know. It's not going to be anything that'll kick you out of CUSNA. So we'll make sure you're there. So the membership requirements, we do volunteer. It has been difficult with COVID, but most of us have been able to get our hours in because of the COVID vaccination clinics, which I think are kind of winding down. But Dawn Clinic volunteer opportunities, if you have your own volunteer opportunities, we do have a card that you can fill out and have signed. There's some examples there of options to help out with, but any volunteer hours that you want to put in, we do ask that you do 10 each semester. So that is part of that. 10 hours. Yeah, there we go. And then that's for UCAN. And then we do have committees within the group. So if you're interested, once you're a member, you're interested in doing helping out with fundraising, campus affairs. Meg was the one who pretty much put together and ran our Student Nurses Week, which was incredible. She can always use help for stuff like that. Gabby, who already spoke, is our community outreach. We have career resources with Catherine. So areas that we can give opportunity for and to see for different areas in nursing careers. And then our class liaisons, Chris and Heidi, take care of social media stuff and really keeping the cohorts in the know. And then of course, talk about membership with Marissa and Liz. So I'm gonna stop sharing and see if there's any questions. Just making sure I don't get to. For CUSNA, a lot of, can we utilize these resources without being a member? There's a lot of things that we'll put up that can be like Nurse Mo was open to the whole campus. There's a lot of things that we do a fun run every year for Nurses Week. There's career resources that if they are available, they'll be publicly displayed. So some of them are, yes, definitely. Absolutely. And then the rest I think are about Dawn. And let me get the contact info for Marissa and Liz. I'll post it here for you guys to have. And that's about it for me, unless anybody had any other questions.
Thank you so much, Jessie. And if you don't mind, whenever it's convenient for you, if you want to share your presentation by email, I can put it on the online course shell for the students as well.
Absolutely. I'm glad to do that. And we all have already set up some times to come because this is a lot of information, just a short amount of time, a couple of weeks into classes to set up some time to talk to you. Cause I know it feels like right now, like when am I going to have time to volunteer and be a part of this? But we'll get you when your brains have settled and marinated a little bit.
Sounds good. So, okay, so I think Upasana, I'm gonna hand this over to you so you can talk a little bit about Future Voices.
Can everyone hear me okay?
We can hear you. Sounds good.
Okay. And my slide is visible, I'm hoping. Sorry, I don't do this often, so.
Yeah, that looks good too.
Okay. And now I can't control my slide, sorry. Hold on, let me do this. Gabby, I'm having some technical difficulty and it was working just fine like 30 seconds ago.
Sometimes it'd be like that. It's been a year on Zoom, but we still struggle.
This is so insane. Yeah, the PowerPoint is just like frozen on my screen.
I'll see if I can get it too.
Okay. Okay.
How's it going?
You all might remember
Not
seeing
good.
Gabby at the badge and supply pickup the last couple of days.
I got her again. Let's see.
This is so insane. I apologize everyone. I made sure this worked like literally a minute ago.
I know everyone's tired of Zoom. If you're still there, do you want to do a little thumbs up if you're here?
I'm enjoying the break.
Good.
So we all take
Maybe
your time.
Okay, we got like 10, 15 people here. That's cool. That's cool. Oh, there's some more. Thanks. It's the little things.
Yeah, I've like completely lost control of my PowerPoint, which has never happened before. And of course it happens on the day we have to present it to everyone, right?
We can just talk about it if Amy's gonna send it out.
Okay. Yeah, that's a good idea. Well, our presentation is pretty short because we realize how long this day is for you all, and this information will be distributed to everyone anyway. And kind of like what CUSMA will be doing, the Future Voices will be presenting or representing ourselves to you during one of your classes. So no worries, we'll just kind of keep it informal, I guess. Well, Future Voices, we are the students who stand for diversity, equity, and inclusion. My name is Upasana, and I'm one of the board members. And I'm very honored to represent this organization along with Gabby. Future Voices was founded just last year by a group of very passionate students who were determined to make each and every individual heard on whatever capacity or at the most appropriate level. Within College of Nursing. We serve the Anschutz campus to foster a space for students to collectively create a more diverse, equitable, and inclusive College of Nursing. We support a lot of the DEI events, trainings, and initiatives within the campus, and we also host a lot of these events ourselves as well. We also connect with other campus groups to build a community in the name of creating a more welcoming environment. One of the most important things about Future Voices is that we respect and welcome vulnerability along with your thoughts, concerns, and ideas. However, please know that there is no place for judgment. We really want you to know that we are here to learn from you just as much we have to offer to the student body. And we have quite a few programs in place, which Gabby will briefly go over. And with that said, I will kind of hand this stage off to you, Gabby. Thank you.
Thank you. Okay, so I'll talk about the committees really quick first. So we have communications, events, fundraising, community outreach, and student affairs. I do just want to highlight the events committee. They are in charge of our ENVEST events, which is ENVEST. It stands for Empowerment Necessitates Value, Effort, Sacrifice, and Time. And the events are super rad and are put on by our group in order to give everyone the opportunity to listen to guest speakers and learn from their unique backgrounds and experiences. And they are free, so that's cool. Next, we also have our peer support network, which allows students to bravely voice any concerns or experiences around diversity, equity, inclusion, and you stay anonymous. So if maybe in your classes you're kind of noticing like gaps for learning opportunities in an effort to like improve diversity, equity, inclusion, like you can put that, or if you're just have anything on your mind, you can let us know and we'll see what we can do about it. And again, it's monitored just by students, not faculty. No offense to the faculty, but we got this. And next we have a few links that Amy will send out, hopefully if we send out our PowerPoint, or I can actually try to put them in a chat in just a sec. But our main website, it has our mission, our group norms that we read out before every meeting, and a few more things on there. So if you'd like to join us, we'd love to have you in our little Future Voices family. So to join, you will email Naomi Lopez, and I'll put her email in the chat. So also, like the few groups that have already been mentioned, we have a few requirements to join, which I think are very reasonable. So as a member, you have to attend at least one of the 2 monthly meetings. They're usually just an hour. They occur on the second and fourth Wednesday of every month at 1 p.m. And then you're also expected to perform whatever duties are assigned to you by the committee chair. So that can depend on whatever committee you're in, like I mentioned before. And then if these requirements still sound like a little bit too much or they're making you feel hesitant, just know that we are all in this together in the same rigorous program. So it's very doable and we are very flexible. And we just know that in order to create impactful change and like passion and drive isn't always enough. Like you need the sustainability to really make things happen. So that's why we have those few requirements. And like Breonna Taylor's mom says, Brianna would always say that apply pressure, pressure makes pipes burst. So that's exactly what we're trying to do. And lastly, that was a lot. I hope you're soaking this in, but on the topic of diversity, I was a little hesitant to join as like a white cis female, like the last thing you picture when you think diversity. But I think the lack of diversity is like a problem that white people historically created. So if you have a voice, you should use it and try to amplify the voices of those historically underrepresented so we can work together to make impactful change. So hopefully there's no barriers or anything like that. If you really want to join, you should. And I'm just like going off everything. I don't know. It's really cool. Everyone's really awesome and it's wonderful people to work with. So I'll put those few links and emails in the chat. So I hope to see you there. And seen. That's all I got. Thanks, guys.
Any questions?
What are some of the type of, like you mentioned, giving like people little assignments? What are some of those, what would some of those assignments look like?
So we have, so under Future Voices, we have committees, and within those we have subcommittees. So Gabby, if I'm kind of steering into the wrong direction, please correct me. But one of the, so INVEST, or like one of the biggest ones, biggest programs that we do is the mentorship program, where we kind of mentor a few high school students. So, you know, you would, if you join this committee, which is under the community outreach, then you would kind of help the chairperson or even take over, you know, a lot of the programs that are placed in within the community outreach, which includes the mentorship program. Is that what you were asking, kind of? So there isn't like a assignment or like, you know, like homework. That's what I think of. There isn't anything. Oh, there we go. Thank you, Gabby. So there isn't like, you know, a specific task or like assignment. It's more like a group work, and you will never be working by yourself. You will always have help from either myself or the chairperson, or just pretty much whoever. It's a really nice group of people who have made significant changes within College of Nursing. Like one of the biggest ones we are working on is rewriting the student handbook, which is also applicable for grad students. So, you know, just know that we are very involved in our community, and it's just a really cool thing that we're doing. Yeah.
So also for like the peer support network, like you could say things like, I noticed we have only been talking about social determinants of health like one time, like we had one lecture, like that should be talked about every lecture really. So if that's something you're like, you know what, let's work on that, you can put that in the survey. Or if you think like, oh, and PowerPoints for health assessments, like we're only kind of seeing a lot of white skin. We're like, what do these diseases and skin disorders look like on other colors of skin? Like that's important because it doesn't represent the whole community. So that's kind of the things that we're trying to tackle and just make lectures and things that we're learning about truly look like what the world looks like, if that makes sense.
And how lenient are y'all on, like, let's say I'm very overwhelmed with school and I'm like, I need to pass on my duties for like a couple of weeks. Would that like take me out of the association, or are y'all guys pretty cool with that? Like, yeah, take off a couple of weeks and then rejoin.
Well, let me pull up our group norms really quick. I know we're kind of running out of time, but one moment, because that's totally fine. Life happens, like you're human. So one of my favorite is, I will take care of myself and take breaks if I need to. So if you're getting super overwhelmed with school, like school comes first. This is extra, even though it's very important. It is school first. So accepting lack of closure and like, let's see, lean into difficult conversations and calling people in rather than calling out, and never feeling obligated or required to call someone in. So it's very, we understand that you're a human and that life happens, but we hope that you can make it if you do make the commitment. But again, it's totally understandable if you get busy or overwhelmed.
Exactly. Yeah. And like Gabby said, we do, you know, this is on top of your, this is an extra curriculum, but we do want to emphasize that, you know, hopefully this does take some level of priority in your life. But with that said, school and clinical does come first. And if you're ever at a point where you're just like, and we've been there, I mean, you know, this first year of nursing is no joke. Just keep an open line of communication. As long as you've been, you know, like an active member, we all need some breaks, and just we are very understanding of that. We just want to emphasize that it is that this program is one of the most, well, all of them are, but I'm a little bit biased. It's one of the most important programs, because as Future Voices, we play a huge role. We're pretty much like a liaison between the student body and our faculty members. So just keep that in mind. It's a significant amount of responsibility, I would say. But doable, totally doable.
I think that answers. Oh, I'll put Naomi's email in here too.
Okay, thank you so much, Upasana and Gabby. I want to turn it over to Alex Dorman, who is one of our recent graduates. Go, Alex. And I just want to say thank you so much for spending some time on your Friday with us, but I'll let you take it from here to talk a little bit about the Nursing Student Council.
Hello, hello. Thanks for the introduction, Amy. Like Amy had mentioned, I am a recent graduate of the traditional program, started in 2019 and just graduated. Oh my gosh. I had my interviews too 2 days ago for the OR and the CTICU, so who knows how those went, but we'll see. I'm here to kind of introduce Student Council and what it's about. I had noticed everyone else has been very prepared with their PowerPoint slides. I'm hoping maybe to keep this a little bit more informal and to give you a good idea about what Student Council is about. So Student Council is a group of students who are interested in making the experience of every student at the College of Nursing really just extraordinary. We talk about processes and create social and fundraising events. There is one meeting every month that all board members are expected to attend to talk about these meetings, to talk about the events and our like programs. And the mission of Student Council is to serve as a liaison between the student body and administration, to promote the student community through the sponsorship of activities and to provide resources that aid students during their tenure at the College of Nursing. It's very wordy, but what I've seen in my time as Vice President of Student Council in this past year has been us doing things like in the previous year, at least, not during the COVID year. In this upcoming year, you guys will see things like barbecues and block parties. And then specifically in the fall, Student Council runs a fleece sale where the philanthropy chair and the treasurer, and then usually the vice president and president kind of come together and create a unique College of Nursing jacket and organize a third-party vendor and then create the official College of Nursing jacket to be sold at a fundraiser, which is very, very cool. Last year, we sold, I think, 230 something jackets and profited close to like $4,000 to be used for this upcoming year. So it's very cool, very cool. Other things we do are like ice skating events and winter socials. We've done Children's Hospital holiday toy drives, merchandise fundraisers, alumni events, and then Nurses Week in the May is a pretty big deal. This year it was more of a CUSNA thing, but CUSNA and Student Council are very intertwined. For instance, we had Angela Cantor, which was our previous president, was also on the board of CUSNA. And so it was really easy for us to communicate, but Student Council and CUSNA talk a lot. Where maybe CUSNA has an idea for an event, but they need funding for it. So Student Council can kind of use some of their funding for that as well. Another big thing that Student Council does is they are part of the Student Senate, or rather Student Senate is part of Student Council. So the Student Senate is a division where they meet with the boards of the school and the senates of the school from all of the other colleges, and they come up with plans and rewriting initiatives. Where does funding need to go? Do we feel like student fees need to be increased? Do we feel like maybe this isn't an inclusive bylaw? Things like that. And then they bring all of those concepts and ideas back to Student Council, where we can then incorporate them into student life and events and whatnot. So that's a very cool kind of distinction between Student Council and CUSNA. We've done things like giveaways too, which is a big thing for Nurses Week, like stethoscope giveaways and the like. The major committees in Student Council were president and vice president, and specifically peer mentor lead as well. So if you haven't heard about peer mentors, I don't know if they spoke in this or not. Peer mentors are the senior students who kind of tutor the junior students in their upcoming courses and send them emails throughout the year, kind of on a monthly basis, can do one-on-one or group study sessions, and then usually attend SIM and CEC, which are your on-site clinicals, and kind of help the juniors along there. So peer mentors are also part of the Student Council board. And then secretary, treasurer, philanthropy, our fundraising and social chair, the Student Senate, and then our class representatives from both the traditional and the UCAN program, who kind of take the thoughts and ideas of their schools to bring back to Student Council. So then again, we can incorporate those into student life. I'm thinking that's probably all I've got about Student Council. Are there any questions that maybe you have for me specific to Stuco?
Alex, I just wanted to add something really quick.
Yeah, go for
it.
Yeah.
You did a fantastic job, but I was just want to say how we're looking for 2 representatives from your cohort to represent you guys in Student Council. And then also for Student Senate, we take 2 people from each class. And so we need 2 people from your class, and you stay both years in Student Senate. Whereas student council, you only have to do it for the 1 year, but Senate, you have to do it for both years. And I'm on Senate currently. And that's all I had to add.
Yes, ma'am. So it's two representatives from each class. That's correct. Yeah.
Fantastic. Thank you, Alex, and thank you, Olivia, for that info. So the last session that we have this morning is just a Q&A from current students. And I think, Alex, you're available to stay for a little bit. Awesome. And I know that some of our other presenters this morning might be able to stay. And I did see that we had Nicole Ward join us, who you might recall, you met her last Thursday at our student resources workshop, and she is the peer mentor coordinator. So thank you, Nicole, for joining us. And I think at this point, I'll just turn it open. I don't know if new students just want to ask questions, or if any of the students, or any of our current students are here. Continuing students want to just introduce yourselves a little bit more about your background, how you got into nursing. I'll leave that kind of up to you all to decide where you want to go from here.
Well, if I actually had a question for current students. It's about clinicals. I am scheduled for a clinical on the 13th, which is just after the first week of class. And I was wondering, I'm a little freaked out by it just because it's so soon. And I was wondering how much you're expected to know and do in that very first clinical.
So that's kind of a tricky question for us because that clinical was canceled for our cohort. From what I understand, it was mostly supposed to be a shadowing CNA kind of shift. I feel like in general, clinicals are always scary walking in and then become very comfortable pretty quickly. I don't imagine that they will expect a lot. Mostly just, a good attitude and willingness to learn is what I think these first clinicals are about.
I had a question. I was surprised to see on my own course program that next summer there's only one course and no clinical hours. And it made me really wonder what summer looks like for, I'm not sure who's graduated and who is going into their senior year, but I'm curious, was that a pretty light feeling summer? And was there actually no clinical hours during that summer? Or are there other things going on that I'm not aware of?
So maybe I can answer that one, since I think I'm the only person here who's actually taken that course, because I think you guys are coming up on it. So you're correct, that summer does not have any clinical hours associated with it. If it's the same course schedule as when I had taken it, which I'm pretty sure it is. It might be changing, I think, for the following year, so the 2022 cohort. So that course is just a research course, and associated with it are some quizzes and I want to say 4 papers and 2 group projects. So it's a lot less didactically heavy than maybe you'll be used to, especially in your first 3 semesters in nursing school. I feel like I probably could have and should have gone out of my way to take an extra course from CU Denver during that time period, or maybe just enjoy my life a little bit more. But it is a far less taxing semester for sure.
And as a follow-up to that, we've heard a lot about how we can't really assume that our breaks are actually breaks because clinicals might be scheduled in that time. But would that be a summer then when they wouldn't be doing that because there aren't any clinical hours going on during that term?
So clinical hours can be scheduled at any time, unfortunately. So during your officially scheduled, officially sanctioned classes, hopefully those are when your clinical hours actually get scheduled. However, especially during COVID, I don't know how frequent it is outside of that. If you were to miss clinical hours, the only opportunity that you may have to make up those hours might be during that summer. So that's something to look out for as well.
Yeah, and I
see.
just wanted to piggyback on that, somewhat related to the conversation about that 3-credit summer, is that please keep in mind that in order to be eligible for financial aid, you need at least 6 credits. So please, students, I think Joanna Cabrera Rosas talked a little bit about maximizing your benefit for fall and spring, maybe trying to save some money for next summer. I don't know all the nuances as to, how you would go about doing that, but please reach out to financial aid if you're needing assistance, because there's not any other courses in nursing you could register for that summer that are applicable to your program. So just please keep in mind that that second summer is just the 3 credits.
This might be a question for Amy or one of the current students. I'm not really sure, but where would we look to see when our classes for fall semester are going to start being scheduled? I'm already scheduling for August for work right now over at the hospital. So I'm trying to figure out when I should expect to start being back on weekends. Because usually I'll work weekdays during the week when I'm not in school.
Yeah, so I'll just chime in quickly. I'll ask the students to chime in about the clinical assignments, but Carolyn, you typically get your didactic, what we consider the classroom schedule, probably sometime, I would say, late June into early July for the fall. But please keep in mind, like you experienced for this summer, you'll get your didactic schedule earlier, but then your clinical rotations won't come till really right before you start a class or even a block. So, keep in mind that Med-Surg, which is your first big clinical and which is going to be in block 2 of fall, you're not going to get your clinical schedule for that till really close to that time. So I don't know if anyone else wants to chime in student-wise in terms of the clinical schedules.
Yeah, like for Med-Surg 2, for me, I didn't get my clinical schedule until the week before. So it really just depends. They're trying their best, but with COVID, it's just, you often don't get much of a heads up, which isn't fun, but that's just the way it is.
Okay, awesome. And then where would we find on the website, to anyone that knows how to navigate it well, I remembered seeing it once, but I can't remember where it was at, the academic schedule. So saying this is break, this is technically when classes are going to start. Where is that under?
So you should find that under the Student Life tab on the College of Nursing website.
Thank you.
Hey, I have a question for any of you that have kids, or if you know any students that had kids. If the online, the version of, we're still doing all online this summer. And I have a 9 and a 6-year-old, and they're pretty good at occupying themselves, but I'm sort of at that point where I'm trying to figure out, instead of putting them in childcare for all of the classes, because there were more just recently added, and I didn't have that planned out for the summer, the schedule that we just got with the simulations, those Zoom classes. Do you think it would be more beneficial to have childcare for the lectures online or for the simulations, or do you guys really suggest just sucking it up and getting childcare for all of it? I'm just wondering what other people have done in this virtual sort of situation, because I know if we were in class, obviously I would have to get childcare, but there's a bit of it's just different. This whole everything just is a little bit different with childcare this summer. Things are starting to open back up. Some things are still not quite all the way open. Is tricky. And I'm sure that everyone that had to have their kids at home with them because there was no childcare has some advice on this, hopefully. Anybody?
I can teach that. So I have a 6 and a 9-year-old when I started the program with me at home, and we did it all online. And honestly, I didn't have childcare. They're pretty good about managing themselves. And then with the lectures, I just made sure that I was in a position where I could do my learning. So they weren't kind of around. And I felt like in the lectures, there was enough little 10-minute breaks and stuff that I felt comfortable having them at the house with me. And then in regards to sim and stuff with childcare, definitely those are long days. So if my fiance wasn't there for them, I would definitely recommend doing like childcare for that. But I felt like the online lectures at the house were easy to manage with kids.
Okay, so the review day and the simulation, I think it's 2 hours.
Is it the simulation that it like you're still at the house for simulation?
Yeah, it's a Zoom meeting. They're all Zoom except for that on-site clinical.
Yeah, basically everything that was at the house, I didn't have childcare for. And I felt more than comfortable with that, if that helps.
Okay, but if I can get childcare for the simulations, you're saying that might be useful for me.
More so like the offsite, like when you're on.
Oh,
like,
okay.
South Denver and stuff, but
yeah.
It's definitely, you know your kid's the best, but I wouldn't overly stress about that.
Okay.
I thought it was really doable to do the online program, forced online program with kids. So I didn't
Right.
have a lot of issues with that. It was actually helpful in a sense because I felt like I had to find childcare less than I would have if I was going to campus every day.
Right. Okay. Thank you so much for that. I appreciate it.
Another question to kind of piggyback on that, do you guys find, so I have a friend who's just graduated the program, Shayla, if you guys know her. She said that it's pretty rare or it doesn't happen as often to have clinicals, like in-person clinicals on the weekends. So I scheduled myself for weekends at work, but then like this clinical that we just got at UC is on a weekend. So I'm just curious if you guys feel like there's any trends that we can kind of like try and anticipate making our work or life schedules around.
They're all very unpredictable. I actually know a handful of people who had their clinicals during, from my clinical group actually, who had their clinicals during the weekend. So I wouldn't really, because it's such a different experience from cohort to cohort and person to person and clinical group to another clinical group, I would just stick to, having as open a schedule as you possibly can. And I know that answer is not everyone's favorite, but it's just how it is. And hopefully with COVID, it's, a little bit more predictable, but even then it's kind of, it depends on what they have available and like which hospitals are taking students. And there are a lot of factors that comes into play that we don't really know as students.
Thanks. I assumed that, but that helps. I don't want to be falsely optimistic about having an easy time scheduling all of this.
I think to piggyback off of that, I would just strongly recommend like reaching out to your employer and like being more flexible with your work schedule, because clinicals, like you can't change your clinicals. And so I took the approach. I worked the whole time through the program, whether it was 1 shift or 2 shifts a week. And I took the approach of just like scheduling out once I knew my schedule. So my work schedule wasn't necessarily prepped, but then I didn't have conflicts come up. And so I know a couple other people that tried to plan more of their work schedule, and then they were left in the predicament of trying to get somebody to cover their shift or swap if clinicals conflicted with that.
And as a note, for this past semester, even after we got our clinical days, we then learned that we would have to go in the day before for like 6 hours to prep. So just keep that in mind. Even once you have the dates, there might be other obligations that you have surrounding your clinicals.
Well, this lady had a 4 and 6 year old and worked twice a week throughout.
Parsonsville.
Yeah.
Cool.
I mean, I feel like a 4 and 6 year old are easier.
Yeah.
Caitlin, sorry, you're muted.
Yeah. Thanks, Gabby.
Something that you wish you had known during your, where'd it go? During your first few semesters. A lot. I wish I had perfected my study methods, to be completely honest. I felt like I don't want to say struggle, but like it was a little tricky because if you didn't know, be prepared to have a couple different lecturers for your classes. And so being able to adapt to each person's, lecture styles was something that I was not prepared for. So just to keep something in the back of your head.
I would say rely on your clinical group. Like, I felt like I was, you don't know these people. So going into it, I had no clue who they were. But they are so, so helpful, even just to hold you accountable, to keep you on track with the scheduling, get to know them and rely on them because it makes it a lot easier.
Yeah, I
this in the
agree.
chat, but sorry. I said this in the chat, but I was so stressed out, especially last summer, about the classes, and probably a lot of you are a lot like that. But I just really wish I had understood that this is all real life application is the important thing, and I wish I didn't freak out so much about the tests and the learning because I just wish I had understood that it was more important to understand that I was going to be applying this real life.
Yeah, and I think my biggest recommendation is my clinical group really saved me. They're like my best friends now. We talk all the time. So I think just getting to know your clinical group and finding people in your nursing class that can have your back, because sometimes you forget due dates and they got you. So I think that was the biggest thing for me to make me successful.
To add on to all of that, I think also giving yourself some grace, because especially when you step into your first clinical, they know that you're still a student. They don't expect you to know everything. And like practicing on campus with the IV pumps, and then you walk in and you're like, oh, I completely don't remember how to do anything. Like they understand that, and most people are very patient, and everyone just wants you to succeed. So I think if you can try to give yourself a little grace, know that everyone's in the same boat, even if you have clinical experience or if you don't have any healthcare experience, like you'll learn eventually and you'll get there.
I think sorry.
I was just going to ask all of you what your biggest advice was for self-care through this. I feel like I'm pretty successful at it, but I feel like everyone I've been talking to it's definitely an art. It's definitely something you have to work on, and it's really hard, I think, in nursing school. So maybe some of your tips for self-care through this process.
It really depends on what you like. For me, my biggest self-care involved just like being with my friends and family, because I was away. I think there were about 3 to 4 months in my nursing, like consecutive months, where I didn't see my friends and family. And I made that decision, and that was not a good decision because I was so focused, in like getting a certain grade or whatever. And I wish I hadn't focused on that, to be completely honest. But yeah, just kind of not only just relying on your clinical groups, which has been so incredibly helpful, rely on your friends and family too. And, for me, my cats are very therapeutic. So just, having them around and just like maybe like, take your dog on an extra walk if that gives you like a peace of mind, or it really depends on what you like to do. But just for me, not isolating myself from everyone was probably the most healthiest thing. Like not isolating, was one of the most healthiest thing I did for myself.
I think to address some of the stuff that in the chat that like Bree's talking about, it is a lot of information. And I personally felt like each semester, like the beginning of the semester, there's just a lot of information, whether that's learning the course shell and the syllabus and getting your clinical schedule and your CEC schedule and putting that all down. I just used a planner and tried to plan it all out, write it all down, and then I just relied on my classmates in my clinical group to really just make sure I wasn't missing anything. But it is a lot. You're not missing any information. You have to look in like 4 or 5 different spots to find it all out. So yeah.
I'd say, I mean, be prepared that at some point you might forget something, whether it's like a discussion post or an assignment turning in, and you know, it won't be the end of the world. Speaking from experience this last semester, it just totally fell out of my head and there was nothing to do about it. Lost a few points and, you know, life goes on. It didn't like kill my grade or GPA. And yeah, I would definitely also recommend like having a group text with your clinical group and then also with your color. Like I think all of us might be in green except for Alex. But we have a green like group me. And somebody, you know, will ask a question like, oh, do we need, you know, a certain number of references for that paper? And you're like, oh man, I totally forgot that that paper was even due. So that's super helpful also.
I see somebody just put in a link to your group meet. If your color group doesn't have one yet, I recommend making it, like Nicole was saying, because also you just kind of need that comedic relief when things are going crazy. So, I mean, luckily we should be in person in the fall, so you'll have that human connection. But over the year of online, the memes, you need it. So definitely see if your group has a group meet, and if not, you should get one going.
I 100% agree. We would all at the beginning of class be like, what is happening to each other? Or like, what's going on right now? So it was great to have other people that were like equally as confused or anything and just be able to talk about it. Because a lot of people in your family won't understand what you're going through. So it's nice to have that group chat with people that know exactly what's going on and all of that. So I totally agree with Gabby.
I had a question because yesterday when they were talking about clinicals, they said we wouldn't have a locker at the hospital. So what did you do with like your phone, your keys, anything else you might have brought? I was just wondering where you guys put those.
For our group, we would just have we would put it in like the locker room at the hospital or something like that. So you have a space, but it's not necessarily like a locked space. So I just brought my backpack every day with all my stuff in it and then just left it in the locker room.
Yeah, I would bring maybe like one credit card with me and just have it on me and then leave the rest of the stuff at home or in the car. And then I think I would keep my phone on me because most of the time our clinical instructors would want us to text or call them, or they would text or call us. And then obviously you're just not using your phone besides like communicating with your instructor. But yeah, other than that, just leaving it in the locker room.
I have a question for Nicole. Hi, Nicole. I'm wondering, since we already will be having some exams the second week of class, are peer mentors gonna be available at that time?
Yeah, for like a review and whatnot.
Yes.
Yes. Yeah. Working on getting everybody assigned and sorry, I just got a direct message. Working on getting everybody assigned and then who's doing what exam reviews. But yes, we will be available. It would probably be, well, yeah, we'll be available. We'll be here for you.
Thank you.
Someone had asked earlier, and I don't know if it was addressed, which I think they asked which semester was the hardest of all. And for me personally, it was this past fall semester. That was incredibly challenging for me. But I'm not sure about everyone. I think a lot of people would agree, but yeah.
To kind of piggyback off of that, Upasana, I think that the first semester is you kind of understanding what's going on, how to read the syllabi, how to finish assignments and whatnot. It's very hard, right, with patho and all of that. And then the fall semester is where you hit into the really heavy hitters of pharm and medical surgical nursing. I think there are two more that I'm missing, but those are the big ones for sure. And those are really tough courses. And then in the following semesters, you do more of the mental health and OB and peds and complex care, but they're spread across those last few semesters. So it's kind of a reverse curve, right? School is really hard in the beginning, and then kind of evens out as you go through. So really put your all into the first few semesters for sure.
Yeah, I would go off of what Alex said, that it's definitely harder and just denser in the beginning. But like, you need to know that stuff to understand what's happening. And then even in your clinicals, doing prep work, things like that, like knowing your patho, knowing the pharm, not so much like the minute details, but kind of the key points will really benefit you. And Anna, I'd say I feel like nursing school's going by pretty fast. I don't know about everybody else. Yeah.
I think also, to add on to what you guys both said, that of course there's certain things you need to memorize, like values and just certain names, but once you can, like body systems wise, once you can get into the habit of understanding how things work, then everything just makes so much more sense. And you're like, oh, okay. And like, you don't even have to review certain things, like it just clicks. That was a cool moment when things like that happen, but definitely try to understand versus just memorize when possible.
I'll also say it's like a fun moment when you start understanding like medical things people are saying to you, and you're like, oh my gosh, I am so smart. And it's amazing. Like 1 year ago at this time, I knew nothing. I had very limited medical experience going in, and now I'm like, oh, should I like be on Grey's Anatomy? I mean, it's just so it's a good feeling. It'll get better.
I'm a little bit curious about our first clinical experience. So I know that it's supposed to be more for us and our own self-practice, but is there anything we should review beforehand? For example, like how to take a physical exam or use a stethoscope or a blood pressure cuff?
So they do a really, really good job of making sure that you feel comfortable. I think on some of our first clinicals, they would literally walk you into an empty patient room and like, this is how you turn on a call light. Like, this is how you turn it off. Like, they're very understanding. The staff, like the nurses are really understanding. Like the patients are really understanding. So like you just need to go into it with a good attitude, a can-do attitude, and you will be totally fine.
And especially for our first clinicals, at least, we were still pretty much in a group or in pairs. And so you had a buddy, which was very reassuring. Because if they're like, who knows, the normal systolic or diastolic pressure, and, there are 6 of you. So if one of you knows it, you're good.
Maybe I'll piggyback off of the how do you study for exams question, because I think that's a really good question. I think, Erica, I love your answer. For me, it was really helpful to look at the PowerPoints before the determined lecture. All of the PowerPoints were put up, at least for me, before every lecture that they appeared. So I would go through the PowerPoint before going through it in class. That way, when I would go into class, I would have already seen this PowerPoint once before. Right. So if I have any specific questions that maybe I had thought of beforehand, I can now ask them during class. And then throughout class, I would write notes, and I did use the iPad stylus with Notability. So I'd be able to write directly onto my PowerPoints. Notes are very powerful, but only powerful if you actually go back and read them. So if you feel like you're never going to go back and read your notes, I find it difficult to support note-taking. But I always went back and read my notes on my PowerPoints. A lot of the exams came directly from the PowerPoints. There were some questions that were pulled from the book, but most of it was from the PowerPoints for sure. So I think for me, to not say anything that Erica said, I think it was important to kind of go through everything before class.
And even if because I know when I take notes, it takes me double, triple the amount of time as just listening to the lectures. Even if you just have time to listen to the lecture, and you can speed it up to 2 times the normal speed. So if you have depending on the lecture, half hour or whatnot, listen to it before class, and things in class will make so much more sense. And then if you're called on, your heart rate doesn't skyrocket because you know some of the words and just a little bit of what they're talking about. So that's definitely, yeah, class goes better if you listen beforehand.
I'm curious how much emphasis was put on knowing the medical terminology and abbreviations that you might see on a unit in the first few semesters of your clinical hours.
I would say there's still things that I don't know abbreviation wise, and we'll just Google it while I'm on my clinicals. There's a lot of terms, but basic stuff, definitely.
Yeah, I Google a lot of stuff when I'm on my clinicals, and they're all really understanding that we're students. So,
and I'd say especially on tests, if they use an abbreviation, they usually put what it actually means right after it, and they'll give you a approved abbreviation list, but it's, yeah, in your clinicals you'll be reading a doctor's note and there'll be so many abbreviations going through it, and you just have to start Googling them because there's just no way to know all of them. And Miranda, as far as getting to your clinicals, it depends on which hospital you're at as far as where parking is and how long you have to walk with it. Like being at UC Health Anschutz definitely comes with a little bit of a walk. But then my group was at Porter, which is a small hospital, and the parking garage was right next to it. But your clinical instructor will give you very clear instructions about where parking is and how long it'll take you.
And I do want to emphasize the importance of punctuality. There were, I want to say every clinical scholar that I had, very nice. I loved every rotation I had, but being late was not exactly something to be taken lightly. So I live up in Broomfield, and so for all of my rotations down at UC Health, it's normally only about a 30-minute drive. But during when I had classes online in 2019, it had taken me at one time almost 2 hours to get to class between traffic and construction and whatnot. So every day after that I knew that I had an important time that I had to be there, I'd always leave at least like an hour 45 early. while I might get there early most days, it gave me time to study or compose emails or whatnot. So yeah, punctuality is very important, especially for clinicals.
Cassandra brought up a question earlier, and I don't know if it really got addressed, of just about different professors being understanding of like your knowledge and stuff. Every professor has a different way they do their learning and their lectures and stuff, but they definitely do want you to know foundational skills and foundational knowledge, because it all builds upon itself. So they're understanding that there's a lot going on and that, you know, new students might not learn a lot, but they do hold you accountable to learning it. Or at least that's what I would say. Ava, in response to your question about living near campus or commute, it's kind of all over the place. I think I live like 20 minutes from campus. We have other people in our clinical groups that live like 45 minutes. So kind of all over the place.
So somebody had asked about responseware in the chat. So I did put a posting out there that I'll be sending out the instructions to students this afternoon. I literally just got them this morning. There's been a few updates to the Turning technology, so I will send that out with instructions how to purchase it for the 2 years of the program. And there's a couple other things I want to mention while we still have most of the students here. Just some follow-ups. I think probably most of you have seen that the health assessment shells are open in Canvas, and I don't know when the patho shells will open, so just hang tight and just keep checking on that. And then somebody had asked earlier this week about access to different buildings on campus now that you all have your badges. And for those of you that weren't here to pick up your badges, I believe Joey Thelma was mailing those this morning, badges in your supplies. But in terms of the access, so as you heard earlier, Ben talked about the library being open 24/7 with badge access. But in terms of like the study rooms, there are some really nice small study rooms in Education 2 North, Education 2 South, and also in Ed 1. And while you have access to these buildings with your badge, I don't know exactly when those small study rooms will be open. I was looking in Ed 2 North this morning when I got here, and the rooms are still locked. So I reached out to somebody in Campus Student Services, and I probably won't hear back from her until Monday about that. So I would say if you're coming to campus, maybe just focus on the library for the moment, and then I'll try to follow up with more info on access to those study rooms next week. And I'll also post the links for all of these sessions from last Thursday session, plus the sessions that I recorded this week at some point on your 2021 traditional Canvas shell. So that's all that I had in terms of announcements. Please feel free to keep asking students questions.
So Emily, your badge question. So there are scanners outside of all of the doors that your badge just unlocks. I lived in the library my first 3 semesters of school. I mean, like literally lived there. There was one day that I was in the library for like 18 hours straight. So.
Yeah, and to piggyback on that, Alex, so in the past, you used to be able to like hold your badge like in front of the sensor without making contact, and it would work. So you all have new badges, like the student badges that you have look different from past students. And I think the badging office is eventually going to phase in all new badges to look like what you have, but your badge actually needs to make contact with the sensor now. So don't just hold it in front and think it's going to be able to read it. You have to actually make contact. And the other thing that Campus Student Services did say to me about when you go into a building, if you're with a peer and there's more than one of you going in, please make sure that you tap your badge to the sensor. You don't have to keep closing the door and like reopening it, but as you're going in, just tap your badge to the sensor so they can track who's been in the building. And I think, typically our buildings are not locked during the day, but it's all due to COVID and contact tracing. So they really want to know, like, if you're in the library at a certain time and there's some report of somebody that may have had COVID, like they can get a hold of you. So there is, rationale as to why they want you to tap your badge, even if you're with friends and somebody's holding the door open. So I just wanted to mention that.
So I have a question based on COVID, and maybe it's just interpersonal, but so I can't get vaccinated, and I feel like I'm just going to be the kid with a giant scarlet letter all the time that never gets to sit next to anybody, that always has to stand alone, and is just masked for the rest of her life, which sounds super fun. So I'm wondering I know you guys have been online through this whole thing, but do you feel like there's hope at all for the situation? Or like those of us, I might be the only one, but for those of us that can't get vaccinated, how we'll handle it?
I don't really know how to answer that, but I know a few people in our class that aren't able to get vaccinated as well. And we're all still very close with them. We all still, study with them and get together and stuff. I think it's more on you and what you feel comfortable with, since you aren't vaccinated. But there definitely are people in our cohort that aren't vaccinated, and they're still able to participate and do everything that we are able to do, if that helped at all. And we're all here to support you. Like, that's what I've been loving about nursing school, is everyone here wants you to succeed and wants to help you through everything. And so, yeah, I don't know. Everyone will try and help you be successful.
And I think for us, like our first clinical rotation that we were able to do, nobody was vaccinated. And so we were all still able to wear masks and do our clinical rotation together, and just like being together, like even 6 feet apart or like with a mask on, like it was just so refreshing to be with people. And I don't think you're gonna be isolated.
One of the students asked how you studied for patho. Would anybody be able to share information about that?
Sorry.
Go ahead, Olivia.
I bought a huge whiteboard and lots of different colored markers, and I drew and wrote everything, because I need to repeat things and write things down. So I just wrote everything down, and then I'd erase it and I'd write it down again. And then like the third time, I just write it down from memory and just do it that way. But that's how I learned personally.
One of my favorite resources, especially for patho, was the Straight A Nursing podcast. It's nice because Nurse Mo is who does it, and so she would have like a podcast episode on potassium, and if you have too much potassium, if you don't have enough, and this is one of like the very first things you'll learn about. And it was it was a kind of a condensed version of what the teachers had gone over in their lectures. And I took my first test, and like so many questions were what she had talked about in the podcast. It was like, oh, and I've been using her for every topic ever since. And so it was just a nice, and, I'd go like walk my dog while I'd listen to it. And just a nice different voice and different way of learning about the material. So that was one of my favorites. Oh, straight A nursing. Yeah.
And I just want to reiterate too, Ninja Nerd. I think Shannon had mentioned that in the chat. Oh my gosh, he is seriously the coolest dude in the entire universe, and helped me so much if I was confused about anything. He's like actually the best. He's a PA, and just always makes things so easy to understand.
My favorite thing about him is that he has this giant whiteboard and he draws out everything. And like he was describing the nephron loops, right? And he'd be like, okay, we've got water coming in here. Well, look over here on this part. There's calcium or, sodium coming in here. And like, it's very visual and he draws it out, but he also like keeps you interested with like how crazy he kind of acts because he's jumping around, but it's easy to follow. And I started watching his videos, and then the registered nurse RN, she uses a lot of like mnemonics. And yeah, I just fell in love with them. I wish I started with them whenever I started with A&P, but I found them like my last couple weeks after. But yeah, they're great and I highly recommend them.
Shannon, can you say those again? So it was registered nurse RN, I got straight A nursing, and then what is the PA?
Yeah, that's Ninja Nerd.
Okay, cool, thanks. Is this all on YouTube?
So I actually found the straight A nursing on Spotify, which is kind of better to listen to podcasts, but Ninja Nerd and Registered Nurse RN are both on YouTube.
Sorry, can I ask a question? How much did you deviate from your previous studying habits prior to entering into this program? Like if you were having success in your other classes, did you kind of follow the similar format, or did you guys have to change drastically?
For me, my degree was in political science, so I had to change drastically because it's just much different content. That's when I started drawing and with the whiteboard. But I know a lot of people that had like backgrounds in science, and if they found something that worked for them, then they continued with that.
I'd say a big thing for me was to kind of adjust to the class, and instead of just following my normal routine, like if it wasn't helping to write down all the notes, and like for patho, it was really helpful for me to take notes. And then most recently in my complex care class, I found it was more helpful to just take notes on the PowerPoint. So just kind of being flexible as to what that class needs, and making sure you're using your time wisely. Because a big thing for me in patho was also like making my notes pretty and like color coordinated, and was that really helpful, or did they just look really nice? And so I kind of got out of that routine going into things like complex care, but in pharmacology, it was still really helpful to be color coordinated. And so just being flexible, I guess, is the best answer.
And I think it depends on the course as well, like if it's pharm or if it's medical surgical nursing. Nursing questions on exams and the NCLEX specifically are totally different than anything you, at least I, had ever really seen before. In anatomy and physiology, for instance, the exams are, what is this bone, right? You just write what the answer is. That's not really how the exams in nursing school run. It's very critically oriented, and you really have to read between the lines and get at what the question really wants you to answer. So in the beginning, it was really hard for me to kind of get used to that, but you get used to learning how to study to answer those types of questions. But it just takes time.
I'd say, yeah, kind of going off what Alex said, it's more helpful to be able to reason your way through the question and figure out what answers don't make any sense than it does to try to like straight memorize things, which will make more sense as you get those questions.
Get some clarity on that. Can you hear me? I don't know if you can hear me or not. But for some clarity on like the way that the tests are formatted, in my A&P, she said she was preparing us for nursing school. So it was never like there was one right answer, you know, it was like A and B, E only, you know, like it was very like tons of different combinations of the answers to where like you really had to know your stuff. Is that kind of how it was for you guys on exams, or?
There's kind of a mix. There's some select all, and then some where there's just one right answer. One thing they really like to do is like, I don't know how to describe this, put a right answer, but then there's a part of it that's wrong. And so you have to make sure you know that that little part is wrong, or else, because even though there's a right aspect, it doesn't make the whole thing right. So it's like, what's the best answer for this? Not just what's right, which sometimes is really hard.
And I totally agree. And that's where the learning how to answer these questions comes into play. And you get used to it, but in the beginning, it's pretty tough. So I wouldn't worry too much about it. Just put your time and effort into really putting your nose to the grindstone. And studying. It helped me to think of it like a job, right? I need to study from 9 to 2, or I need to study from 12 to 5, or whatever I decided. Monday, Wednesday, Friday, Sunday, and it kind of forced me to get in the habit of that.
I will say thank you guys so much. I gotta go, but thank you. You've definitely lowered my blood pressure today. So thank you.
You're welcome.
Thank you.
Before too many of you hop off, I also wanted to let you know that, I don't know if anyone mentioned it today, but CUSNA, we are going to be doing a like used scrub sale. So there will be an email about that. I know you guys have clinicals coming up, and I don't know how many of you have bought your scrubs, but just be looking out for that email.
Thanks for that. I've been looking for that. I've been waiting for that.
It's been hard to coordinate still being off campus, so we're working on it, but should be coming out soon.
All right, thanks.
I just want to say thank you again to our current students and recent grads. We really appreciate your time. It means so much for the new students to hear from peers. I'm going to go ahead and stop the recording now, but I'll hang around for a few minutes if anybody has individual questions for me.